Welcome, everybody. Just going to give it a couple more seconds for folks to join, and then we will get started. Okay, great. Well, thanks to everybody who's joining the California Elder and Disability Justice Coordinating Council meeting this afternoon. Just a reminder that we continue to meet virtually. Closed captioning and ASL interpretation is available. To enable captions, please select the live transcript or CC icon on your Zoom toolbar. The meeting slides, transcript, and recording will be posted to the California Health and Human Services Committee webpage. You can check that out and also go back there to view past recordings and materials. We are saving time for public comment for attendees joining us by phone. You can press *9 to be added to the queue and we will unmute your line. And those who are joining us via webinar on your tablets or smartphones or computers, you can use that raise hand icon on your toolbar. In addition, we do have Q&A open, so feel free to drop down your comments or questions there, and we will return to them during the public comment period. Great, and with that, I think this is where I transition it over to Director Susan DeMorris.
Thank you, Maria, and welcome everyone. Welcome back to our council members and to our state, local, and federal government partners who are joining us today. And a very special welcome to the public members and participants who are listening in. Thank you for being here today. Just to refresh all of our memory, this is our third meeting of this coordinating council, and the goal is to increase coordination and develop recommendations to prevent and address the abuse, neglect, exploitation, and fraud perpetrated against older adults and adults with disabilities. And I want to thank our council members who have been working between meetings to help further that goal so that we don't rely solely on these gatherings. And we'll be hearing about the work that's transpired between meetings later in the agenda. I also want to give a very special welcome to a new member of this committee, of this council rather. Eric Dowdy joins us from the Alzheimer's Association. He has replaced his colleague because he is new to this role, and we are thrilled to have Eric as a member of the coordinating council, but also as a co-chair. And I want to thank Eric for accepting, for being voluntold or accepting his request to serve as co-chair. And I think it's so important that we're linked between our state government partners and stakeholders. And today I'm in Los Angeles for a very momentous occasion. The Los Angeles County has launched a new Department of Aging and Disability as of today, with the full backing of the Los Angeles County Board of Supervisors. And they have integrated and consolidated and included the populations that we're talking about today, including adult protective services. And it's just really exciting to join Dr. Laura Trejo, who many of you may know from her work in Los Angeles County, to celebrate what we're trying to do here around coordination. And that is one example of how things can be better coordinated by this new integrated model that Los Angeles has. I was also joined this morning by Dr. Laura Muscata, who many of you know. She was there to give remarks for LA County. You may or may not know that Dr. Muscata, who is from Southern California, she's a professor at USC. She's the director of the National Center on Elder Abuse. And she reminded the audience that 1 in 10 older adults will suffer from abuse, neglect, or exploitation. And she reminded us all that the statistic is 1 in 2 when it's a person with Alzheimer's and dementia. And for that reason, I'm especially grateful that Eric is joining us to bring his expertise and to make sure that the population impacted by Alzheimer's, dementia, and family caregivers are well represented. So I want to thank everyone again for being here and for buckling up for the next 3 hours. We finally think we've hit the type of agenda that we strive to have, where you're hearing less report outs from state government officials, and we are hearing more from the stakeholders and experts who are part of this group. So we're always open to feedback. If it doesn't work for you, please let us know. But I'm really pleased with today's agenda that we'll hear so many voices and perspectives while we're gathered together for the next 3 hours. So with that, Eric, I turn it over to you to make some introductory remarks for the group.
Great. Well, thank you so much. And I am so happy to be voluntold for this position. Director DeMorris, it's such a pleasure to work with you and your team and all the stakeholders. I have worked in this field for 20 plus years, and it's really encouraging to see all the great momentum that's being built both at the state and among stakeholders. So very happy to see this committee or council move along, put together our priorities for the master plan for aging priorities. So I'm looking forward to working with you all on that. So just want to say thank you. Happy to be here. Happy to work with you all. And I will make an effort to reach out to you council members to talk with you individually to the extent possible and just learn about your priorities as well. So thank you. I appreciate the opportunity.
Great. Thanks, Eric. All right. So just a refresher, if you want to say hello in the chat as we scroll through the members of the council, welcome to all of you. There we go. Thank you, Maria and team. Wonderful. And this is today's agenda. I want to thank Amanda Lawrence, who provided all of the advanced materials to all of us, which included the official agenda. But we will have a break at about 2:10, and we'll be hearing, as I said, from a number of you who are here. And we're going to start with the work. Let's see. All right, we'll go ahead into the next one then. All right. So we're going to go ahead and start. And I want to thank Andrea and Achilles for the work they did between meetings, for helping to cue things up for all of us. When we first embarked on this work, when you all accepted this assignment, a gap analysis was one of our goals, to really see where we could be most impactful and where intervention is needed in our system. So I want to turn the agenda now over to Andrea and Achilles, who will share 3 scenarios that they, through the work that this work group has been doing, they think will really highlight where the gaps are in our system. So welcome to both of you. And the screen is all yours now.
Hi, thank you. We were hoping that a slide that we had put together would be there. You go. Thank you very much. So I will give an overview of the work that Andrea and I have done, and then I'll let Andrea provide some additional input if she has it. And we're going to be speaking in a very high-level view of the work that we are doing. So we looked into 3 scenarios that you can see on your screen, one about suspected financial abuse of an older adult in a community dwelling, another one about a suspected physical abuse of a person with a disability in a long-term care facility, and a self-neglect. I like to say that there are a large number of reports that at least the APS program receives that have self-neglect, and the second largest segment of reports are financial abuse. So we wanted to look into these 3 scenarios. The one with long-term care, it really does encompass the long-term care ombudsman and other programs and entities that are much more varied than the other types of abuse. And what we did, we wanted to look at what are the actual processes that exist for someone to report a suspicion. We have mandated reporters, we have family relatives, anybody who might be concerned about an individual, a vulnerable adult, and where do they go? What happens next? Who's supposed to be involved? And how is that working? Is that system effective in terms of that process to get all the assistance that that individual may need? So going through those different scenarios, we've been able to identify several gaps, and we're working on what are some of the possibilities that systemically could help minimize, if not really bring down to no chance things can go wrong, which that should be what we all need to strive for. So we've been meeting, we've been discussing, going through these gaps, and we have a wealth of information that's still in progress, and we hope to come up with something much more meaningful in the near future. Andrea, do you have anything that you'd like to add?
That's a great overview. And again, so grateful to be part of this process, and grateful for everyone who's on the call with us today. Our ultimate goal is, as we say in the slide, essentially to come up with some policy recommendations to address these gaps. So starting from a person-centered perspective, starting from the experience of an individual person working their way through each one of these scenarios and identifying ways that collaboration is or isn't happening. How can we improve services to those individuals, to their families? Ultimately, how can we improve outcomes for older adults and people living with disabilities across the state? We're really looking forward to also seeing how this work can dovetail with some of the proposed priorities. For example, adult protective services, legal services, conservatorship. Those three topics that we're going to talk more about today are really integral to the work that Achilles and I have already begun doing, and also really looking forward to incorporating the equity work and paying special attention to how services are provided, how they are accessed, and making sure that there is as much equity as possible in our system. So we look forward to updating everyone on this as we continue to make progress and provide additional information, and even solicit input from some other stakeholders as we move forward towards providing some policy recommendations down the road. Thank you.
Thank you both. And Sarah, did you want to add something there?
No, I think that was an excellent overview. I think, this will be so helpful to illustrate, as you said, kind of at the very micro level where the gaps are in the system. And as you said, I think it really will dovetail nicely with the work in the policy priority areas. So thank you so much, Achilles and Andrea, for heading this up. And we will definitely be in touch, in between these meetings, as we've done, with opportunities to revisit this work when Andrea and Achilles are finished up with their first draft. Whoever wants to join for the discussion from this committee can do so. So more to come on that. So thank you.
We especially appreciate the person-centered approach. We have so many providers and practitioners here as part of this council. Thank you for using the lens of the person, the individual who's impacted.
Right.
So now we get to move to the meat of our agenda, the heart of it. This is, and we'll refresh the group that before we even commenced as a council, we conducted a survey. We took all of the recommendations that had been submitted as part of the master plan for aging and other avenues. And we put out to the group a survey monkey to help prioritize the work of this council, at least in our initial phase. And we now have two council members, Vivian and Lisa, who are coming back to us, taking that information, and they've taken it further, and we'll be presenting an overview. So please go ahead, Vivian and Lisa.
Thank you. I will start and then I can pass it on to Lisa with some just initial thoughts, and then we will get into even more meat with people who are going to be presenting on the individual priorities. So first off, I just want to thank the members of the council for allowing me to make some initial comments, and I'm really excited to see everyone here, and I feel really good about the work that we've done so far. So the proposed areas for reform, adult protective services, legal services, and conservatorship really touch the lives of older adults and adults living with disabilities throughout the state. But they're also integral in upholding many of the principles of elder and disability justice. So, for example, legal services organizations in California operate throughout the state and provide high quality, free legal representation that ensures both older adults and adults living with disabilities are able to access public benefits, remain in safe and affordable housing, and stay connected to other community resources. But unfortunately, due to funding restraints, the level of representation for many older adults is limited, and often legal services organizations have to focus and prioritize their efforts on limited representation to serve a broader swath of people with the funding available. And further, those living in rural areas face additional geographical barriers in accessing legal representation that is near them. With adult protective services agencies throughout the state, they protect many Californians every day, provide trauma-informed and culturally competent approaches to abuse and neglect. But APS is also strapped. They are serving the ever-growing population of older adults who are experiencing homelessness, knowing that this community needs even more support than the other already vulnerable APS clients, and that their living situation makes them particularly vulnerable for abuse and neglect. And finally, with the conservatorship system, while not perfect, conservatorship is a tool that can be strategically used to protect the rights and autonomy of those with cognitive decline, and really looking at this system to make sure that it properly balances the autonomy and protection of older adults, can allow many to remain in their homes and communities, aging on their terms. And while each one of these issue areas covers a different aspect of the aging and disability system, they all interact with each other and they all face similar challenges. Issues with accessibility of their services, funding inconsistencies, and the issues around increasing equity and outreach. So this council has a really unique opportunity to not just reform, but also uplift and support these existing programs and supporting the work that they're already doing in our communities, creating a lasting change and a culture where equity is at the forefront of every decision. So in prioritizing and uplifting the most marginalized of us, we will see a ripple effect that improves conditions for the entire community of older adults and adults living with disabilities. And by centering our work in equity, we can ensure that the goals of the MPA and this council are actually fulfilled. Really centering equity ensures that the council is not just seen as another bureaucratic creation, but for what it really is, a group of incredibly dedicated individuals who believe that they can make a better way for older adults and adults living with disabilities in California. Therefore, as we begin our dive into these issues, I hope we can really keep equity at the forefront of our minds, utilizing the equity principles that we've drafted, our equity tool, and also constantly striving to create systems that represent all Californians. And I will pass it over to Lisa.
Great. Thanks, Vivian, and thanks, Susan, and other members of the council, and to all our stakeholders. It's really exciting to see so many people on the call today. So I really appreciate the opportunity to comment also on these three topics that I think really cut to the heart of elder justice. Adult protective services is really kind of the centerpiece of our whole abuse reporting system. legal aid is absolutely critical in protecting victims and also recovering assets. And conservatorship is a powerful tool, often the only tool for protecting some of the most vulnerable here in California. So we're really delighted at CEJC to be able to provide you with a couple of sections from our blueprint to help inform the discussions. And you should have received those as part of the materials for today. The blueprint is the third in a series of blueprints that are supported by the Archstone Foundation. And it really draws from the collected wisdom of a lot of experts and stakeholders that we've collected over the years. Our most recent version, I think, reflects some important shifts in our thinking about elder justice that I wanted to mention today. For one, it calls for balancing punitive approaches, which we really relied on in the past, with restorative ones. And what I mean by that is services to help rebuild relationships, address trauma, and also recover monetary losses and other kinds of losses. We also are renewing our commitment to equity, which is very much in line with the goals and priorities of this group, as Vivian has talked so eloquently about. And the reality is that here in California, those who rely on our public systems really don't get the protection that they need and that we think that they deserve. That's particularly true of Black, Indigenous, elders of color, the non-affluent, and those in rural communities. And we believe that equity really requires trying to break down those barriers to access. Our overly complicated mandatory reporting system, which I talked about at length at the last meeting, practices that strain families instead of strengthening them, and cross-reporting all cases to law enforcement, which can also be a detriment in some communities. So we really need a no wrong door approach to our reporting system. And because, as we've already heard, APS lacks funding, a lot of our programs prioritize the most egregious cases, which prevents people from getting help during those early stages when problems are brewing, when abuse could be prevented. And that's also true of legal aid. We have a huge gap in legal services, particularly to victims of financial abuse, particularly in terms of recovering losses. And that includes people who've been exploited by family members, by crooked professionals, by predatory businesses, which include banks, contractors, nursing homes, lenders, many others. We're hearing about new scams and new kinds of exploitation, it seems like almost on a weekly basis. And we believe that to really have an impact, we have to start partnering more with the private bar. We know that there are some barriers to doing that we've talked about in the blueprint, and also exploring innovations like restorative justice and expanding the use of mediation. I think one of the greatest threats to elder justice, which has already been talked about, is cognitive decline. And that's really why estate planning and advanced directives are so important. And as we point out in our blueprint, estate planning isn't just for people who are rich, which we sometimes think of. It's really critical for preserving people's wealth, not just individually, but across families and across generations. We also in the blueprint talk a lot about conservatorship, which when all else fails can be a really powerful tool and the only one for protecting people who have cognitive losses. But we know that the system is really rife with problems. Efforts at reform have been erratic, mired in controversy, and often ineffective. I think that's been true for as long as I've been in this field, which is almost forever. What typically happens is that there'll be an expose or a high profile case or a government report that leads to calls for reform. But what happens is that conservatorship is an extraordinarily complicated process. We have different systems for people with dementias and people with mental illnesses, for controlling assets and controlling people's personal lives. And we have limited conservatorship for some people, but not others. And so a lot of the reforms that are proposed, and they're coming out fast and furiously, often affect one group or one particular problem and have unintended consequences for others. So we really need to take a comprehensive approach to conservatorship. Most of the reforms that we need or that are being proposed place enormous burdens on our public guardians who serve really the lion's share of people that need conservatorship in the state. We know that they lack funding. We also know that they lack state leadership and guidance, which is why we're supporting a really strong investment in that program and a state home for it. We also believe that it's time to educate the public and the professionals about conservatorship and really do a deep dive. There's a lot of misunderstanding and misperceptions about the system, and we've suggested some ways to do that. So we're going to be releasing additional chapters of the blueprint in the coming months, and we invite the council and others to use it. These on the screen, you'll see our earlier blueprints. We don't have a cover yet for our new one, but we do think of it as a working document, and we welcome input for it. And I just want to close by acknowledging that we're at a time where we're really facing enormous threats to justice for people of all ages. And these times really call for leadership. And I think that this council provides an unprecedented opportunity to lead the way in protecting the rights of elders and people with disabilities here in California and beyond. And so we're really ready to work and get started. And I'm looking forward to working with the rest of you. So thank you.
Thank you, Lisa and Vivian, very much. And I could not agree more that we're in a unique position to lead with all of you. And there's evidence in the budget that just passed July 1st about strong support for this work. So I'm now going to turn it over to Sarah Steenhausen, who's going to set us up for our priorities discussion.
Great. Thank you so much, Susan. And a big thank you to Lisa and to Vivian for setting the context for why these priorities have been selected by all of you and how important these issues are and how they, as we said, intersect with the gap analysis work as well. So we really appreciate your leadership and helping us get to this point where we can focus on these key issues. At this point, I'm really pleased for each of these priority areas. We've lined up members of the committee and members of related efforts who are going to be providing an overview of the issue, kind of very high level, as well as the main challenges to the system, as well as some high level system change concepts. So this, just to clarify, we are not having an entire discussion in 30 minutes where we're able to fix and solve all the problems with the APS system. This is the beginning of the work on these issues for this council. So we're really excited to have with us Lisa Coleman of the California Commission on Aging and Valerie Smith of the Adult Protective Services Program in Santa Clara County to start us off in our deep dive onto APS issues. And they're going to speak for about 10 to 15 minutes. And then we really want to hear from you in the second half of the discussion. And again, this will help set the discussion for the work in the year ahead for this group. So I will turn it over now to Lisa and Valerie. Welcome.
Hi, everyone. This is Valerie Smith. I think I'm going first, and I'm hoping there's a PowerPoint. There we go. I see Lisa nodding yes. Hi, everyone. Thank you so much for inviting me to give this brief presentation, and I really want to emphasize brief overview and insight to adult protective services. And I just have a short little disclaimer, and that is that I am a program manager in Santa Clara County, so I'm not representing the state, and I'm also not a researcher. So what I'm telling you is based on either state statistics or county statistics that we are required to report, and a lot of just anecdotal information over the years that I've been aware of and participating in statewide committees. So brief overview of adult protective services. It's a state-mandated program designed to help elders and dependent adults who are victims of abuse, neglect, or financial exploitation. The highlights of APS is that we are supposed to receive reports of abuse and investigate cases, and then through that process, link victims to services with the overarching goal to prevent and remedy abuse, neglect, and financial exploitation. And just a sidebar from the Administration on Community Living that has recently been really supportive of APS nationally, elder and dependent adult abuse, of course, neglect and financial exploitation is considered a critical public health issue. Abuse survivors report higher rates of depression. They often withdraw from social interactions and may blame themselves, which results in shame and silence. And this also can affect existing health conditions that they may be experiencing as well. So this looks like a lot, but I'm not going to read every word. APS serves two populations. Just quickly, elders are defined as residents of California age 60 and over. This just changed in January of this year. It used to be 65 and over. And dependent adults are residents of California between the ages of 18 and 59 who have physical or mental limitations that restrict their ability to carry out activities of daily living and protect or advocate for their safety and their rights. And that's just a brief snapshot of there's more detail with dependent adults, but it has nothing to do with where or how they reside. So a lot of people see that word dependent and they think, oh, well, they're not independent, and that's not actually part of what was intended here. So in a nutshell, APS interventions may include consultation. So there are mandated reporters who need to make reports to APS, but there's also community members who can always call and make reports. And when they call APS, it's not necessarily they have to know right at that moment that they're making a report. They can call for consultation, information, and referral, and guidance. So that is one intervention APS provides. When a case is accepted for investigation and assigned to an APS worker, the focus is on the assessment of the elder and dependent adult, their well-being, which includes things like their living environment, support system, strengths, and also any health or medical needs. Allegations are examined and the level of risk is assessed, and a plan is developed in ideal circumstances with the client's participation. We also may be arranging for emergency services, shelter, and medical or health care. And then collaboration is kind of the third area where either in the investigation or also at the intake level, APS social workers or caseworkers may be doing referrals to community services, benefits, and may coordinate with family, friends, other agencies, and so forth to meet the needs of the elder or dependent adult. The principles of APS, just in a nutshell, they are person-centered. So the concerns of the elder or dependent adult are the starting point of any intervention. So part of our assessment includes assessing what the elder or dependent adult understands or what they want to talk to us about regarding the abuse allegation, and then also what services and needs that they have that they think would be helpful to them. They have the right to refuse or accept services at any time. So even if a APS worker starts working with someone, they can agree to services, and then midway they can also change their mind and decide they don't want to have services anymore. The interventions, as I mentioned, are directed towards safeguarding the well-being of elders and dependent adults. APS was not intended to be a long-term ongoing case management activity. Most of our cases are open between 0 and 90 days. There are some exceptions to that. Basically, again, the focus is on preventing and remedying abuse and neglect. And we are looking at promoting self-sufficiency as well. So here is, because I'm from Santa Clara County, here's a little snapshot to give you an idea of what APS is facing. So since 2016, just in Santa Clara County, we've had a 41% increase in the number of abuse reports to APS. And we've had a 20% increase in the cases for investigation over that period of time. And this is consistent with some of the projected population increases. In 2016, Santa Clara County did a study and did some projections, and the outcome, I'm sorry, there was a chat that popped up. So a 40.5% change within the next decade, from 12.9% of the population in 2016 to 17.4%. And again, that's just in Santa Clara County. And it was done for people age 65 and over. So I don't have those numbers for 60 because this was done a few years ago. Also, oops, just one little thing, greater increases is expected. If you see the little table below, I know it's very small, but a greater increase is expected among elders 80 years and older between 2026 and 2036. So just kind of giving you some basics. Okay, next slide. In a nutshell, the policy basically is, there's a lot of welfare and institution codes, and I did put the link, that is a hyperlink so people can go to it. But each county is required to establish an APS program that provides in-person response 24 hours a day, 7 days a week, and also to receive reports of abuse, but also to go out on cases as well. And again, for providing immediate intake or intervention, or both. So this is a long slide. I'm also not going to read it. I think many of you may already know that California law does require certain professionals and persons and categorizes them as mandated reporters. This is just a brief caveat. When they talk about care custodians also mean administrators or employees of most public or private facilities or agencies. Sometimes people think care custodian, it only means if you're in a caregiving role. So I just wanted to highlight that on this slide. Next slide. Thank you. So types of abuse that APS investigates, there's technically 8 listed here, but we always count 9 because we count sexual abuse oftentimes separately. What I wanted to say about this is what Achilles spoke to just a few minutes ago, which is that self-neglect is the highest rate of abuse that's reported to APS, and financial abuse is the second, and oftentimes they're tied county to county. So these are 2 areas where that differ greatly, in my opinion, from a physical abuse intervention or a neglect intervention or some of the other types of interventions. So, and those, more information about those can be found in the link I provided there. Recently, as everybody hopefully knows, there's been statewide expansion for APS. We haven't had an expansion since 1999 when Senate Bill 2199 went into effect. So AB 135, which went into effect January 1st, changed the definition of an elder from 65 to 60, and also changed the definition of dependent adult. There are some other changes. I didn't capture them here, but for sake of this discussion, this is, again, high level. just wanted to make note of that. And then also, APS also had an expansion with the Home Safe program, which originally began as a pilot grant, and it began in 2018. It ended in 2021, and then it became a permanent program in the most recent. Where did I write it? Yeah. Oh yeah, the Budget Act of 2021. Sorry, it appropriated more money to all counties when initially this had just been pilot for roughly 25 counties. So 2 big areas where we're expanding services and trying to partner with community agencies and so forth. Next slide. So this is actually my last slide, and it's it has the least detail on it. But here, in my professional opinion, are some areas where there's opportunities to transform APS. Caregiving. Caregiving has to be one of the #1 issues that we see in APS on a regular basis. And IHSS, In-Home Supportive Services, is a great program, but it is only one program, and not everybody qualifies for it. You have to be Medi-Cal eligible, and a lot of people can still be Medi-Cal eligible. However, they'd have a high share of cost, which then could make IHSS prohibitive for some people. So what I would like to see, because in APS, as I mentioned, self-neglect is one of the highest types of abuse reported. A lot of that has to do with people aging in place in their own homes and not being aware of what services to access, or being afraid to access services, or them being cost prohibitive. So looking at caregiving incentives, not just someone gets free room and board if they take care of an elder or dependent adult. Currently in Santa Clara County, we have someone who we've seen on numerous occasions because they can't sustain a caregiver, and we'll get a call that's an ER call when the person needs their adult diaper changed. And so these are the kinds of things that we're seeing every day. That's just one little snapshot. But caregiving often is leading us to having to do emergency response type of APS response when that's not really what it was intended for. I mean, what APS was intended for. Enhanced partnerships, I'm a big believer in MDTs and cross coordination, but a lot of times APS is told to do that and is not then given any kind of organization or platform or assistance with that. And recently we've gotten a lot of funding for Home Safe, and that's great because it'll help us enhance the partnership with the housing and homelessness resources. So that's one area that we could grow. But there's other partnerships that I think need to happen. We need better partnerships with the regional center. In fact, the regional center models are something that could be something that APS could be designed as more of a system of care rather than just one aspect. As I think we all know, a lot of our services are siloed, and we touch the same clients and same issues, but maybe don't always work in good coordination together. So that's what I mean by enhanced partnerships. And finally, health and mental health liaisons. So this is an ongoing issue as well. We in Santa Clara County are fortunate. We have an interagency agreement with our behavioral health department where we have one mental health clinician who's stationed with APS, and she is able to go out on cases with us and either access the behavioral health mobile crisis team. She's also able to do other kinds of interventions, mental health interventions that might be needed that APS workers aren't able to do or access well. But I also think, years ago, there was an initiative, the Coordinated Care Initiative, which was part of IHSS and then also the healthcare agencies. And I think this was a model that I wished had continued because I think it had a lot of strength in its beginning stages. However, it was more focused on Medi-Cal, Medicare, so Medi-Medi clients. So again, lots of areas for growth and transformation, but also remembering that APS is still trying to meet the need of what we're tasked to do initially, which is just receiving the reports and going out on the cases. So anyway, that's my spiel. So I will hand it over to Lisa.
Thank you,
Valerie.
Okay, I'm gonna jump in, Sarah, because I want to give as much time for a conversation. But I want to thank Valerie for that overview, and a lot of what I'm going to say is in some way a duplication of the speakers you've been hearing earlier today, which is both good and bad. It's bad if you find it boring, but it's good if what you're looking for is a confirmation that a whole bunch of us are seeing the same kinds of problems. And that to me is encouraging, because if all of us from different perspectives are coming across the same sorts of problems, well, that feels like something we can fix. Nicole Howe has an expression, everybody needs to be a little uncomfortable when we're looking at how we improve things, how we change things. Everybody's invested in something in some way or another. And if we're going to change, it means everybody's got to be a little uncomfortable. So this slide, I imagine many of you have seen it. I'm not sure who the original author was. It probably was Sarah. I keep coming back to this slide because to me, this demonstrates just how many touches are involved when we're talking about mandated reporting, licensing, complaint investigations. Lots of different state agencies that represent provider services, consumer groups, and the licensing agencies. So when we think about the unintended consequences of a change over here and how it's going to ripple over to everyone else, that's what this slide is about. So next slide. So the premise to me of this coordinating council was looking at what isn't working well, and then what can we get better? What can we do? And I just want to start off, maybe everybody already knows this, but I don't like having conversations when we focus on the problem without just being very gentle and saying, there's a lot of people that are working really, really hard every day to try and reduce harm, trying to find a way to help an older adult or a disabled adult. And so when we're looking at these, when we're criticizing these programs, I just want to be very clear that I'm not criticizing the individuals that are doing the work. I don't think anybody is trying to place blame. So it's just acknowledging that where we are today may have been intentional, but then again, it may have just been an evolving process, and we can evolve into a different, better program. So I was looking at what do I consider some of the biggest problems. We've already heard about it before, the no wrong door. We've got lots of wrong doors. we have a very complicated system for the providers as well as for the consumers. Thinking back to that slide before of all the different places a person could enter into the system, and how are we going to help lessen that barrier, identify ways in which the providers can get out of those silos that Valerie has already identified. And so to me, the focusing on the goal is improving of coordination of services. Then consistency, we've talked about that already, that program services vary by region. And I don't think they vary by region just because these are the people that live in this area and this is how we like to do it. I think program services vary by region more based on resources. That if you are in an area, a county that has more funding available for the APS program, then there may be more activities that your APS representatives can provide. If you are in an area that has a lack of community services, I mean, for example, going back to my route with the Ombudsman program, if you're speaking with a resident in a skilled nursing facility and you ask the question, would you like to leave the facility? Would you like to go back in, live independently? And they say yes, but there are no community services that support that activity. Then isn't it almost cruel to be asking the question? So I think that's something we just have to be cognizant of, that we need to do a better job of providing services with a lens of equity across the state. It is hard to imagine that just because an older adult lives in one zip code, they're not afforded all of the same benefits of another older adult who lives in a neighboring zip code. Another issue, inconsistency for the criteria of investigating cases. Yes, we have a new definition of 60 and above, and yet while the law is very clear, it is 60 and above. I think if you were to actually do a practical application of that law, different regions would be defining what is a vulnerable adult a little differently. Person who might be 75 might not be considered vulnerable, but a person who's 60 in homeless or having many health conditions might be considered more vulnerable. So it is just an inconsistency in how we identify what services we're going to do. The focusing on the goal, up-to-date training opportunities. And I'm excited that the $4.6 million was included in the budget to continue with training for APS. And I'm going to say something. When we look at CPS and the amount of money that is available for training and supporting our child protective services, that there's quite a discrepancy. And I don't want to pit one against the other. I absolutely refuse to go into that narrative that says, well, you know, children need more money, adults need more money. We're the 5th largest economy in the world. We need to find a way to support all of our vulnerable adults, whether those are all of our vulnerable individuals, whether that is children or older adults. That falls into, there was 2 different comments. Carla made a comment and someone else presented a question talking about the complex nature of providing advocacy services to people that have cognitive impairment. You know, a person has the right to refuse services. And it's a very difficult thing when we are trying to determine, does the person have the capacity to understand that the activity they're engaging in may be harmful or risky? Does the person have the capacity to understand that there may be a different way to live, to not live at home, to live in a community environment or in licensed care? It is like a King Solomon's thing of trying to get all that information. And so we absolutely need to have as much training and support for our providers. Then another focusing on the goal is routinely reviewing, identifying the emerging issues. What do we see coming so that we can get into a position to better advocate in advance? So often our organizations we're just stumbling to catch up. So what can we do to get ahead of some of these problems? Workforce. That is absolutely a huge issue and opportunity for us. We are experiencing very high turnover, very high burnout. We have very large caseloads. We are asking individuals to do more, and we're not providing them necessarily with the tools to support them. An encouraging opportunity is if we were to entice more people into the geriatric field, perhaps with student loan forgiveness, perhaps with more grant opportunities. We see many people going into social work for children and families, and that may be because they just like that environment, but it could also be because that's where they're getting reimbursement for very large student loans. And so something that we can work on. The next slide, please.
Lisa, just so you know, we're already at 1:55 about, and we have till 2. So this has been amazing, but maybe if you could just summarize and then we'll open it.
Absolutely, definitely. Broker of services or provider of services, you've heard that before. That really, my overarching, what we can do, we need to educate the public. The public is looking to these entities to be the provider of services, and we're not funded for that. And so I would say that that's something we need to do. And then the final slide would be about research. We have to just start doing a deep dive. What's the best practice? What can we replicate? And whether that's inside the state. I'm super excited about Valerie's mental health clinician. Love to see that replicated across the state. But then again, there are also other states that do some really innovative work too.
Fabulous. This has been such a wonderful high-level overview, not only of the APS program, but some of the emerging issues and areas of opportunity. I particularly love how you all framed Valerie and Lisa, some of the opportunities, whether it's looking at how to move towards a more coordinated system and better integrating with other services across the continuum, looking at consistency and training and services and an investigation, which is also an equity issue, looking at building the workforce of social workers in the APS program, as well as enhancing research and data development. Also just piggybacking on that with some of what Valerie highlighted and the need to think through caregiving incentives, enhanced partnerships, looking at the regional center model, looking at examples like the Home Safe program, how that's developed amazing opportunities with housing. And then finally, looking also at, how we can ensure APS partners with health and mental health services. So we want to turn it now to our committee members to see, let's just go for 5 minutes. We have time for 2 questions or comments. Would love to hear from you. Howard, I see that your hand is raised.
Yes, it is. And I just wanted to say that one big problem is, there isn't enough people having trouble. All the agencies are having trouble getting good people. And that's I think professionalizing the caregiving services will help a great deal. And I also too, I've been in need of nursing care for the last couple of weeks, home nursing care, but I haven't been able to get it because they say that no one is available and they don't have people for it. So we need to be working on getting more good people into the caregiving field. We need to provide incentive for them. We need to professionalize the caregiving field. And quite frankly, we need to pay them more too. You want good people, you have to pay good money.
Right. Absolutely, Howard. I think that ties into a lot of the work that the state is doing right now to try and both build the workforce pipeline and improve retention and training and incentives for the range of our workforce needed across the continuum. So you raise very important points. Thank you so much for that. I see are there any other committee members that would like to add on to some of what the considerations are that were raised by Valerie and Lisa? We've had a number of questions and comments in the chat and question and answer. I also want to note Claire Ramsey from the Chief Deputy Director at Department of Social Services, who says that CDSS is looking forward to continuing the work together to strengthen the program throughout the state. Thank you so much, Claire, for being here. Okay, I see a hand from Ellen and then Vivian and Gloria. We will take this to 2:05. So Ellen, I will turn it over to you. Thank you.
Okay, well, thank you so much. I really appreciate being here today and hearing a lot about APS. And I think, I'm just a huge supporter of adult protective services, working in this area for quite a few years. One of the things that we always struggled with was the lack of case management or care management after the APS investigation concludes. And I'm just wondering if there is any move afoot to look at the need to fund the ongoing service. I think of programs like MSSP or even CalAIM that work with the Medi-Cal individual, but for the middle income or others that don't have access to those resources. And I think many people do need ongoing service. So I just have that comment tonight.
Thank you so much, Ellen. That's very much appreciated. And Vivian, I think your hand up was up next, and then we'll move to Gloria.
Yes, thank you. I made this brief comment in the chat, but I thought that the presentation really brought up the issue of scope and what the actual scope of APS is. We know what the scope is in the statute, but does that actually match the work that APS workers are doing on the ground? And does that mean that we need to expand the scope, limit the scope, expand, funding and resources so that they can actually fully do all the work that they are being brought So I think that there's maybe some deeper discussions to think about what the role of APS is, and then other organizations, other agencies in the state that can take on other work and collaborate with APS to better use the resources we already have.
Great. Wonderful point, Vivian. And I'm flagging that as a discussion point for the future, for the work of this group, looking at scope and, you know, what are within the resources of the program right now versus the scope changes. Okay, Gloria.
Hi, everybody. I'm not too sure exactly which thing I want to talk about quickly, but as far as you're saying that you need more caregivers that want to caregive, and that's I've been hearing from a lot of people, friends, that they have, a couple of them have gone on to different parts of their job, like a different department, is because the change now is they have to get their cell phone, and as soon as they arrive at the property that they're supposed to caregive, they have to now punch in or exactly tell the time that they arrive, the time that they leave the home. They're feeling like dominated. They feel like they're like, that's not fair, that they have a responsibility and they care for the people. But I guess whoever is on top of it, the management, the county, it's like they're not, otherwise they don't feel supported. So I just want you to know that. That's a lot of them have quit doing the respite or in-home supportive services because they feel that way. And
Thank you. Go ahead.
And also on the adult protective services, you're so on target. Whoever, I forgot the name of the girl that spoke about it, but there has been a lot of contractors that have taken advantage of several people that they have. I mean, I know them myself. I told them, I spoke with them, that the contractor tells them that they're going to put a lien on the house if they don't pay a certain amount of money. And the person has actually given them the money, and that's not even true. If they have like insurance in their home and they have to use their insurance company to get it fixed, they make the claim higher than it really is in order to get more funding from the insurance company. I mean, I know everybody probably already knows this, but all these things came to my mind when we were discussing all this. That's all that I wanted to say.
Okay, thank you so much, Gloria. And I think that your first comment was referring to the electronic visit verification program at DSS, which is really not in the scope of what we're talking about today. But we, of course, have colleagues from DSS on the line that you can reach out to or discuss with afterwards, and appreciate also the other comments that you made as well. So at this point, what I think we can do, there's a number of comments in the questions area from our members of the public. We are technically into the time for public comment. So I wanted to give the opportunity for members of the public to weigh in. We've again heard about a lot of important and emerging issues and opportunities in the APS program, which we will continue to discuss in the work of this committee. This is just the kind of context setting discussion. Maria, did you want to give any notes about public comment?
Yeah, absolutely. Thanks, Sarah. So again, I see that we have one hand raised from Sil. So Sil will open your line in a minute. If others want to raise their hand, if you're joining us by phone, that's *9, and you can always use the raise hand feature. And I do want to flag that it looks like committee members are responding to questions in the Q&A as they come in. As they're answered, you'll see them pop up and you'll be able to read through those. I think for the sake of time, we'll open Sil's line and see if anybody else wants to make a verbal comment, and just encourage folks to look at the Q&A for other comments and questions that have been shared. Sil, go ahead.
Hi, yeah, my name is Sil Vossler. I am formerly the senior elder law attorney at Open Door Legal in San Francisco, and now I run my own practice, the Vossler Law Firm in Oakland, where I litigate financial abuse cases. One of the problems that I'm seeing time and time again is that when I take financial abuse cases across the state, I have seniors who have viable civil financial abuse cases where years ago they may have been referred to or had APS investigate their case. Maybe there was a referral to the police for prosecution. But I've seen this issue a number of times where seniors are not getting referrals to the civil attorneys that they need to help them recover the property that's been stolen from them. I have one client, for example, who had $1.2 million stolen from him in 2019. And he was referred to the police, and he languished in poverty for 2 years after APS had seen him and the police had seen him and looked into his case, because nobody ever gave him the information that he needed to find a civil attorney. And so I think it's really important when financial abuse cases come in that APS, sort of piggybacking on that partnerships question, is APS making the referrals to whether it's legal services or state bar lawyer referral networks, where we can get these cases in the hands of the attorneys who are qualified to help these seniors recover the assets that have been stolen from them. And because the police can't recover these assets for people. That's really the purview of a private civil attorney or a legal services attorney. And so that's the point I wanted to make.
Great. So thank you for giving that example. I love that because that's kind of what I see this kind of issue emerging with is gap analysis that Andrea and Achilles are going to be leading. It shows kind of where the breakdown in the system is at the local level. So definitely flagging that. I think wanted to see if any of the members of the committee want to respond to that, but also before that, also want to see if we have other comments from the public that anybody would like to raise their hand. Otherwise, I'd like to see for a few minutes if our committee members want to weigh in on any of this.
Thanks, Sarah. I'm not seeing any other hands. Again, I think questions and comments are coming in through the Q&A, but I believe our guests are able to read through those as time permits. So, oh, I see 2 hands, Sarah. So Pamela and then Fang. Pamela, your line's open. Pamela, you may need to unmute yourself.
Okay. I just wanted to remind people about the disability community. I have a daughter, an adult daughter. I'm an attorney. I'm on the Contra Costa Developmental Disability Council and the advisory committee to the State Council on Developmental Disabilities. Many of the problems that the developmentally delayed have are those that we see with elders. There's a great deal of abuse of all kinds, and they lack services just as much, if not more sometimes. But the problems are almost identical, and I just want to be sure that people are thinking about those as well.
Thank you, Pamela. That's a very important consideration. I see that we have a few of we have one more comment, I think, from the public, and then I'd love to see, before we turn to the break, it looks like Lisa and Megan would like to respond. Any other public members?
Hi. Hello, can you hear?
Oh, yes. Hi, Fang, welcome.
Yes, I have a question about the hate crimes to the abuse, to the elderly. Have any legal representation for the victim of the hate crime?
So I'm hearing you have a question about representation for people who are victims of hate crime. Is that correct?
Yes.
Thank you for that question.
Sarah, this is Claire. And saying hi. I'm not sure if you're specifically referring to the recent grants that were awarded to fight hate crimes. If that's what you're referring to, I'll get some information. Department of Social Services is the one administering those grants. So I can get more information for you about the connections between the hate crime grants and places serving older adults. But if you're talking more generally, you know, obviously hate crimes could be investigated as a form of elder abuse, although likely other agencies could get involved as well, including the police. But I don't know if any of the any other people want to speak to sort of the nexus there.
Thank you, Claire. That's super helpful. In addition to what Claire provided to answer that question, any committee members have any further resources to share with Fang? I'm not seeing any hands, but thank you very much for highlighting that important point, Fang, and Claire, let us know if you need anything else in terms of following up on that information. I see two hands, Lisa and then Megan. And then we are going to take a break until 2:20. So first Lisa and then Megan. Thank you.
Hi there. Can you hear me?
Yes.
Okay. I just wanted to reinforce Sil's concern about needing civil attorneys. We're just being inundated with financial abuse cases, and a lot of these cases for people to be restored, to really be made whole, oftentimes they need civil attorneys, and that's something that we've talked about. There are a lot of barriers to that, which I mentioned earlier, and that includes the fact that people that work for public agencies, people that work for private nonprofits, they're really gun shy about working with private attorneys and don't know when it's appropriate and when it's safe. I think it's a great issue for this group to possibly talk about providing some guidance to when that's appropriate, and how we can use panels, and maybe, that might be an issue for our legal services developer to try to help come up with guidance and some partnerships with the private bar.
Sorry, I was just going to say, I love that. I think this is a really great place for this committee to continue weighing in. And we're really excited at CDA that we have a new statewide legal services developer who is listening into this meeting. So we'll be sure to bring him into the conversation as well. So thank you for that suggestion and for highlighting these issues. I see a number of questions have come in. We don't have time for them, but we are going to be tracking all of this and look forward to continuing the conversation. So Megan, I will turn it over to you before we go to break.
I also wanted to echo the comment about referrals to civil attorneys. Coming from the criminal prosecution side, I can say firsthand how important the civil attorney referrals are, and how much they can aid the criminal process. The criminal process can take a long time. You have to get warrants for financial records. You have to determine, who's involved. Whereas a civil attorney, particularly if there's a power of attorney involved or someone who might be abusing their power of attorney, a civil attorney can go into court quickly and demand an accounting early on. And so you don't necessarily have the time delays that you so often see in the criminal process. And there is one question about if the civil attorneys have to wait until the criminal process is over. There is no need to wait. The civil attorneys can jump in whenever. One doesn't necessarily come before the other. So I think the idea about referring people even to the Bar Association, the California Bar, is certainly a great starting point. And I like that this has come up for conversation.
Great. Thank you so much, Megan. That's super helpful. And Valerie, you close us out.
I just wanted to say, and I did respond to Sil in the Q&A about the civil attorneys. County councils, at least in Santa Clara County, often guide APS staff not to make direct referrals to certain, to one specific attorney or another, because of optics, because it could appear that we're saying that this is the attorney you should hire. And what they tell us is to refer them to the local bar association. So in Santa Clara County, that's the Silicon Valley Bar Association. I think there is a huge gap there in the ability and the understanding of the elder or dependent adult knowing how to then follow up with an attorney. So there's definitely a lot of work to be done there. And I agree with what everyone has said.
Absolutely. And particularly, I'm thinking for people who don't know who the perpetrator is. I have a friend whose mother got her computer. She ended up getting swindled into having somebody log on to her computer and her life savings were taken away within 24 hours, $26,000, and she's at a loss for what to do. And she doesn't know who the perpetrator is. So very complicated system and issues, but this has been a fantastic conversation. I want to thank Valerie and Lisa for getting us started. I think we have a lot of work ahead of us, but really wonderful comments and input from the members of the council. We are set to have, I just want to turn to Maria, you know, we're probably 5 minutes behind in our agenda, and I think we're okay for a 10-minute break. And when we return, we are really looking forward to continuing the discussion on our priorities, and we will start with a focus on our legal services system. So we're really excited about that. I think it will dovetail nicely from this conversation. So thank you all.
Linda gone? Yeah, she's gone already. Now.
Okay, we have about 1 minute for everybody to come back in and from their break, and we'll get started in just a second here. Okay, well, it is 2:25, so we are happy to bring everybody back into the meeting and now launch our second part of the discussion today, which is focusing on the issue of legal services. And I think that Vivian and Lisa earlier did an excellent job of outlining why this is such a critical priority area for this council to address. So I'm really pleased to welcome with us today somebody who is a lead member of the California Elder Justice Coalition and who is Executive Director of Legal Assistance for Seniors in Oakland, James Tregeri. We are very fortunate to have James here. He's, I've been told, known as the expert on these issues across the state and has contributed a lot to the development of the chapter on this issue that the Elder Justice Coalition has released. So with that, I would love to turn it over to you, James. Welcome. After you conclude your presentation, we will open it up to discussion and encourage you to engage in that component of our the presentation as well. So welcome.
Thanks for having me. Real pleasure to be here this afternoon. I'm going to try to do this quickly in 15 minutes. I'm encouraged to have heard the other presentations, and I think there are a lot of common threads. So a lot of this is going to be a little bit repetitive, but I think, again, that's a good thing because I think we have some real common solutions. So I'm going to channel my inner New Englander, and I'm going to move real fast through my slides. So my first slide, kind of giving you an overview of the legal system and really how it connects to these other pieces. So effectively protecting older Californians and persons with disabilities requires a highly coordinated civil and criminal system that also needs to be paired with social and medical support services. So it really needs to be the complete package. The saying I use in my office when we have attorneys that come on board to orient them to this work is that if there is an older adult that has come to legal assistance for seniors that just needs legal help, I have not yet met them in 13 years. So that is to kind of get that context there. In terms of elder justice, it can be a little bit complicated when we talk about legal services because we're really talking about a broad variety of services, advanced planning, criminal prosecution, civil litigation, restraining orders, conservatorship, family law remedies. Those could all be on the table to find a complete solution for older adults, and that's just from the legal realm. And that also means we have to involve a broad range of partners. That could be the DA, law enforcement, county council, legal aid, civil attorneys, and non-legal providers like the public guardian, APS, case management organizations, mental health providers, food support services, to really create a complete package of service for that older adult. What makes it a little bit complicated too versus other specializations, if you hear someone is a wills and trusts attorney, they have a very specific set of legal knowledge. When we talk about elder law in these solutions, what can make it daunting is that we're talking about a wide variety of jurisdictions and specialties that may need to be called upon. There might be federal, state, federal and state law and consumer protection and regulatory agencies involved in finding and creating a complete package of a solution. In terms of legal aid, what we're typically talking about, what can be supported is housing rights, public benefits, immigration, estate planning, advanced healthcare directives, and restraining orders. Individual legal aid organizations have maybe some other additional services that they offer, but I'd say that's a pretty general set of services that get supported. And again, while that's, there are some broad truths and statements that we can make about legal services statewide, these issues and solutions are going to be very unique when they're implemented through counties. Next slide, please. And so just a couple of the recent developments to be aware of. This is by no means a complete list, but just to give you some things that are happening. Some counties had been working on and had elder courts that have really brought together a wide variety of practice areas to work on, a person-centered approach to that solution in court. So that's meaning that in some counties, in Alameda County, what that meant is that criminal elder abuse happened in the same courtroom right after civil elder abuse, which could then be paired with, and the departments would be talking to each other. I know in other counties, social workers are present or it's connected to probate court, but really trying to create efficiencies and alignment in terms of when we're talking about complicated issues, that it's really centered on quickly and effectively meeting that older adult's need. Recently, the Judicial Council has been giving funding to do a review of the conservatorship system in California. I'm not going to touch on that too deeply because I know we have a full, robust conversation coming on that. And the California Bar is looking into potential expanded use of paraprofessionals to make legal services more broadly available. Well, I think there's no dispute that there is need for increased support in legal services. I think there's a lot of concerns on what that model could look like and oversight to the people providing those services. Additionally, one of the main barriers we see in legal aid is concerns around working with older adults who are impaired, and not just in legal aid. I think this is across legal services. This leads to attorneys being unwilling to bring forward valid claims of abuse. Competent attorneys are rightfully concerned if they have a client to direct them, but some lack the expertise and the training to properly analyze whether a case is still possible and how to then navigate that litigation. There's a real lack of prosecuting entities for abuse where it involves more kind of complex regulatory systems, financial systems, and standards of care. There's only a small pool of attorneys in California that really are able to handle these cases. Even with the opportunity for advanced fees, it's difficult to get civil attorneys to take these cases because there's just not that many out there. Referrals from adult protective services and others, as I think was highlighted a little bit earlier, continues to be unstructured and not done in an efficient or in the most efficient way possible. And connecting older adults to appropriate legal services is really daunting. A recent survey by the Legal Aid Association of California found that most older Californians do not seek out or receive legal help for two main reasons. They don't recognize that the issue is legal and they don't know how to access help. Rural areas face additional logistical burdens in accessing help, with some areas only having one attorney available for several counties. In addition to the lack of access and understanding of the effectiveness of legal service, abuse is still a vastly underreported problem and is often only reported after abuse has been happening for some time. In terms of the legal context, that can make for limited remedies available to then support that older adult, meaning that we can stabilize their situation, but a lot of times getting back lost assets and other issues become a lot more complicated the further into the abuse interventions happen. There are also some statutory issues around capacity declarations, lack of understanding of independent review, and the financial elder abuse statute is unsettled around standards of liability. So we also have some statutory work to be done in terms of clarifying how we're supporting older adults. Again, lots of challenges on the legal side. So these were the bulk of the slides. We got a lot of work to do. Older adults with impaired capacity who do not have appropriate estate planning documents or just planning documents in general are left vulnerable for abuse. Having their medical wishes not followed, prolonged hospitalizations, and homelessness. While conservatorship is definitely an option for protection, in my opinion, less restrictive options are not being leveraged and explored and aren't robust enough in terms of, in the arc of a competent adult all the way through conservatorship, there's a lot of room in between for other types of supports and interventions that we need to be leveraging to both prevent conservatorship and to help people live with the independence and dignity in the community. There's also a lot of public mistrust of government agencies and law enforcement in communities that have been historically disenfranchised that have led to a lack of trust and underreporting. especially in areas of elder abuse. It can be very difficult to get older adults to engage with the system when they find out that the remedy or what they then do when they have a restraining is they have to engage with the police department, or they have to engage with their local law enforcement. That can be a barrier to them accessing that service. Financial abuse and the lack of appropriate supports around property and home ownership have led to a gutting of equity in disenfranchised communities. There's a lot of issues around foreclosure, around scams around PACE loans, and there isn't a robust enough network of providers providing support in that space. Systems, everything that we're talking about today, and this has been mentioned in other presentations, is still uncoordinated and siloed. This can lead to disjointed and often less effective legal services for older adults. So again, I always come back to, if there's an older adult who just needs legal services, I have yet to meet them. So that means we need to be closely aligned and paired with social services, with medical services, with food services, to ensure that we're taking a very holistic look at the older adult. And even if my attorneys or attorneys in legal aid or any attorneys aren't handling those parts of it, we need to be quick and effective in making sure that they have access to those resources that they need. And there is a real shortage, a gap in disparities in access to legal services for non-affluent older Californians. Underserved groups that we know about include BIPOC communities, homebound elders, adults with limited English proficiency, and those living in long-term care facilities in rural communities. These are often populations that have a harder time accessing services, and we need to do a better job of going to the client, making sure that our services are available and easy to access. And so quickly, if we focus on, just making sure I'm on the right slide, focus on access to justice, what are the opportunities? In legal aid, I see, the main opportunities is focus needed on outreach to disenfranchised communities to increase understanding of legal services that are available and can help. In addition to the access needs to be improved, and that can be expanded language capabilities, greater number of staff who can do the work. There's just a numbers issue that's happening in legal aid where we just don't have the attorneys to do the work. Or in rural areas, mobile legal clinics I know are being explored, and I think that's a great option. Building more stronger, more formalized partnership with medical and social service providers, I think, is a critical piece to creating this coordinated system that really will be cross-beneficial. And then there are additional needs to strengthen services in estate planning and homeowner protections. In terms of civil law, I think we've kind of already discussed that with Sil and others discussing the California Bar Referral Network needs to be made more robust to give older adults access to competent civil attorneys who are trained in elder law and financial abuse. And with that, we need to increase outreach and training available to build the pool of attorneys that are going to be willing to take these cases. Right now, there's just not a lot of attorneys out there who can do the work, so we need to be aggressive about training newer attorneys to do this type of work. In the criminal law realm, criminal prosecution of commercial creditors needs to be prioritized. I think Sil can speak more to this, but there are several kind of more business front types of abuse that are not being prosecuted, that are allowed to operate and are not being stopped for many, many years. And then additional trainings for prosecutors to allow them to address issues that may arise in working with older adults. And so for a lot of prosecutors that come into this work, older adults may not be their specialty. And so some specialized training around working with older adults. Restorative, as Lisa mentioned, restorative justice approaches to elder abuse need to be better understood and implemented as potential strategy in appropriate cases. Supporting the reestablishment of elder courts, which provides a central point of coordination for complex cases that head across several practice areas. And data collection. We need to have better data that demonstrate the impact of legal interventions in terms of outcome, impact, disparities to access, and unmet needs. And the last one I would add that I think I just forgot to put in is there is also, I think, additional need in terms of the statutes, and that the elder abuse restraining order statutes right now do not offer the same protection as domestic violence. And I think there is an opportunity there to push for more robust availability of those options and elder abuse restraining orders in that particular space. As Lisa mentioned, CEJC has the Elder Justice Blueprint, which goes a lot deeper into a lot of the things I discussed, and has more kind of bullet pointed interventions that could be explored. So I encourage you to take a deeper look at it, at some more specific recommendations, but I wanted to give a link to that document, and just really appreciate being able to present and for the opportunity to be here.
Wonderful. That was an incredible, very concise, thorough overview. I learned a lot, James. Thank you. I think this gives us a lot to consider in terms of the issues that you identified and the potential opportunities for reform. So now I'm really pleased that we can open it up to discussion with the committee members. A number of really important questions being raised in the chat, but I just want to also highlight, and in the Q&A section, just what I took away in terms of the opportunities to focus on, looking at outreach to increase awareness of services, access in terms of language access, and in terms of number of actual attorneys able to provide services, building partnerships across medical and social services. I think this is something we hear across the continuum. And these partnerships should be done all together. And I think a lot of times partnerships relies on data too, and the information and data exchange and addressing those issues. Looking at estate planning and home ownership protection, you mentioned, looking at the issue of the civil law and access to a really strong and robust referral network, which is also something we highlighted, of course, in the APS discussion. Criminal law, just opportunities, looking into the commercial predators, looking also at restorative justice, revisiting the elder courts, data collection, looking at statutes for elder abuse restraining orders and others. So that's just a handful of what James identified. Committee members who would like to ask questions or make comments, I just want to thank you again, James, for that outstanding overview.
I'm sorry to move so fast.
No, it was excellent. It was perfect. It gives us time now to engage. Vivian.
Yes, thank you so much, James. I think there's a lot of things that you brought up that are really, really important. But a few things I wanted to point out. I think you really highlighted the fact that there really are a lot of overlaps between legal services and then other agencies, specifically APS. And I think it's great that we're addressing those two agencies and the conservatorship/judicial system, because they really do all overlap and interact with each other in a lot of different ways, but we do not see the collaboration happening between these different agencies. For example, I know some people were mentioning in the comments in the chat about figuring out ways to refer clients to civil legal aid or finding attorneys for them. And that's really an issue that overlaps many different systems. In other states, they have created ways to make referrals through the state bar system, or sometimes it's actually through the legal aid agencies will make referrals. They have a list and they, pick someone random off the list. But this is something that really can't be solved in isolation, like APS just figuring out this issue on their own. This is really going to have to create some kind of communication and a system through both of those agencies, and that's going to be different all throughout the state, because there's not just one legal aid, there's many legal aids, and then there's also the organizations that are funded by the Older Americans Act that provide services just for older adults regardless of income. So we've got to really coordinate with all of those. So I think that there's really an opportunity for the legal aid developer to help figure out that issue. And then I know someone also mentioned this issue of communicating, like once you do a referral to a legal aid organization or a private attorney, and keeping that connection. And again, lawyers, just like social workers, have confidentiality rules that are very strict, and they cannot violate them or they will lose their license. So really, if there's more knowledge between the different professions about what are your limitations, what can I tell you, what can't I tell you, and how can we create a system where we can communicate and use each other's information, but also maintain the confidentiality of our clients, there is a way to do it. It's been done. People have done it in other states. We just need to, really outline that and understand each other.
Fabulous perspective. Thank you so much, Vivian. And Marty, and then after Marty, I see that Howard has his hand raised as well.
Okay, thank you. Marty Yamoto, family member, CDCAN, California Disability Senior Community Action Network. First, James, and thank you very much for that presentation. And thank God, and nothing against Southerners, but the fact that you did it kind of in the New England fast style, that was really appreciated. But thank you. I really appreciated the way. Also, the other thing I really appreciated that you used inclusive language to not only talk about older adults, seniors, but also people with disabilities. And I think one of the things with the council and also the Community Living Advisory Committee, we're going to have to do our best that we just don't end up being advocates who are siloed in how we speak and talk about only older adults. My sister had developmental disabilities, physical disabilities, and she was an older adult, a senior, when she died. And she had problems crossing every one of those systems. And if we're going to be true to our mission, we got to be true to the way we speak and be accessible so that people who are listening to us know that we are talking about them. If we're going to help them, they have to know that we're talking about them. But my question actually on legal services, and one that I hear a lot from families and, you know, especially those older adults, but also people with disabilities who are adults, is what happens? There's a need for legal services, but it's not just for the issues of abuse that is occurring from another person or financial abuse from a family member or whatever, or isolation or the lack of or being placed in a harmful situation. What if that's caused by a government service or a service that they're eligible for and now they're cut off because now they've lost eligibility for whatever reasons, or they were cut off or their services were reduced? And often I hear people the need for legal help and there is none. And if that's not abuse, then I just want to know someone to define me that abuse is not when government or, and by the way, that's not reflecting on the people who provide for government workers or work for providers or regional centers. It's not even about that. It's about when people feel they're harmed and losing services. Is that not, where does that fall into what we're talking about in terms of abuse? And also the need for legal services, and does it? And if it doesn't, I think we need to explain that to a lot of our community, why it doesn't, because the majority of problems that people have, not majority, I'll take that back, but a large number is they're not getting the help or the services they need, which actually would ward off financial abuse or other forms of abuse. So I'll throw it out there. And I said that in a California way of speaking, which is Japanese American, which is sort of fast and verbose. Thank you.
James, I didn't know if you wanted to respond at all to Marty's very important points that he made.
Yeah, I appreciate the recognition of those issues, and I think it calls out to that point that LAC was really showing in their survey that we are not doing a good enough job of communicating, making that link that yes, your issue is legal and you should be seeking legal help, and that is actually the most effective tool for you to use in this space. And we need to have lawyers doing it. And so to Marty's point, I mean, when I hear you speaking, I think I'm thinking of Social Security, I'm thinking of different benefits that legal aid does provide those services. And if you're and I think most legal aid providers do. And so to hear that people aren't being connected in your community, I'd be curious to explore further, because I would say for Alameda County, that those are services we try to provide. And it depends on the agency, it depends on the regulation, of course. You know, all government agencies or regulatory agencies are not created equal, so it really depends on the case. But certainly when we speak of benefits, that's some of the bread and butter of what we do, because we know fixed income clients who are reliant on income every month, that if that is disrupted, that can be incredibly impactful to their well-being. So that's some of the main work that we do here.
Great. Thank you, James. Howard.
Yes, thank you. I feel that elderly people with disability are very vulnerable to abuse and exploitation, and perhaps we should consider doing a statewide public service announcement on radio and TV, informing these communities of the services that are available, and telling them, ask for help if you are in an exploitative or abusive situation. People should not have to suffer that. I think that's very wrong. And I think that perhaps public service announcement would help a great deal. Also, I think we need to, keep in mind that but senior disabled community suffer many of the same problems as elderly people who are not developmentally disabled, and we need to keep this in mind too.
Yep.
We need to keep that in mind too.
Yep. Thank you, Howard. I think that's a really great point. I love the themes about recognizing that people don't live in silos. We have an increasingly aging population of people with developmental disabilities, as Marty was talking about, and they don't think of themselves as a person who fits within one service delivery system. And so the more that we can make these connections across and include it with legal services, the better it is for the consumer. So I like the thinking and the creativity about how we might be able to better spread the word about services that are available while also expanding access. So I saw a hand raised from Tony Anderson. Tony, if you want to just remind everybody of your affiliation as well.
Oh, yes. Tony Anderson, Valley Mountain Regional Center. I'm the executive director. Thanks, James. A lot of questions for me, but in particular, I was thinking about are our attorneys or legal aid services prepared and able to work with somebody who's using a support decision maker or some other facilitator with them. And then the other question I have is if they are to be successful, or a person with a disability is to be successful in a civil case and then they get their money back, is there any benefits protection that occurs with the attorney, or do they have to get that on their own, and are they at risk anymore?
Those are great questions, Tony. I think the first one is a big yes. I mean, I think we are always looking for, we have a client, but I think when talking about, if the client is able and wishes for others to be involved in the decision making, and they're people that are providing good support and services, I think we do welcome people into the fold. That can, but it's always at the direction of the client, right? That they are comfortable, they want that person to be involved.
Mm-hmm. Do you have any professional standards that you have to follow, or is it just the person with the disability makes the decision and that's it?
No, we definitely have standards, and there are definitely times where people will try to insert themselves and there's red flags. So a lot of it is just experience, training, and time in this space, learning when someone is inserting themselves as a friend. We see lots of friends of family, and that we have to be very careful in who we engage with, and it always has to be at the direction of our client, because at the end of the day, that is who we're serving, and that is probably the strictest standard we're going to follow. I think to your second question, there needs to be a lot more education around that. I've seen more than one case, unfortunately, where an attorney did really great work around getting a settlement and getting that money in the door, and didn't understand the part two that you were talking about, of that there needs to be exploration of a special needs trust. There needs to be exploration of how that money can be delivered in a way that preserves benefits, that really maximizes and doesn't disrupt other supports, other money that they may be using to survive. So unfortunately, I've seen cases, and this is kind of what we talk about when we talk about elder law, is very different from someone specializing in like wills and trusts, because you have to be aware of such a broad range of issues. And that's a perfect example where, like I said, several cases where the civil part got taken care of and was well done, and that attorney did a great job, but wasn't thinking, or at least didn't think to engage another attorney who was more specialized around how that settlement should be structured. So that really speaks to that point where we're talking about we need a lot more training in this area of where the intersections lie, even within the legal system, right? Of how the different areas of law overlap, interplay for the benefit of our clients.
Wonderful. Thank you. We have time for one more question. This has been very, very informative discussion, and appreciate it. Andrea, and then quickly we will move to Ellen after that. Andrea.
James, thank you so much. What a really valuable presentation. Coming from the prosecution and law enforcement side, one of the big challenges we run into is we have a number of elder victims who we are, kind of working through the criminal process. And as you said, that is a much slower process than the civil process. So we will often recommend that people, if they have an interest in it, pursue a civil remedy as well. The problem that many of our victims run into is that they've lost all their money. So they do not have the resources to pay for the services that are available. So I think one of the gaps that, this conversation has brought up for me is just the sense that we need more low income options for older adults and people with disabilities who, again, they've already been financially abused. And so being able to recoup those losses in a time sensitive time frame before the suspect files for bankruptcy or spends all that money or sends that money out of the country. I just love to have that be part of the dialogue as well. Just more resources, more availability for folks who are traditionally underserved by both the criminal and the civil process to have greater accessibility to that. But thank you so much. Great information.
100%, Andrew, you're 100% right. And I'm sure Sil is screaming through his screen right now. That's part of why on the civil side, there is enhanced, basically there's a chance for enhanced fees and contingency. So someone being low income or not having money, that shouldn't be a barrier to accessing civil legal services. It is, I mean, we all know practically that it is, but it really, we need to do better because it shouldn't be. There are other ways for that attorney to get paid and for that client to be made whole. The system exists. We just need to be using it more intentionally and more robustly.
Thank you again.
Well, thank you all for your comments. We are past time. So Gloria, I'm going to ask if we can hold your thought until we have time for more discussion. I want to make sure we have opportunity to get to our wonderful discussion on conservatorship issues and then talk about where this all leads in terms of next steps and the day of action. Before I move to Scarlett, I wanted to see if Susan, if you wanted to say anything briefly, because I know you're going to have to hop off.
Just thank you I'm learning so much. Thank you all. And we're really seeing where, where we can connect things. And as we embark on years 3 and 4 of the master plan for aging, I'm seeing some things congeal here where with experts, the experts we've already heard from. And Scarlett, I'm so sorry. You're one of the other experts that we really appreciate as a partner at the Department of Aging. So thank you all. And we'll just keep continuing this conversation. And we really look forward to all of you participating on September 20th. You'll hear more about that later in the agenda, but it's so important personally to me that these issues be conveyed in that setting and that we put forward a very proactive agenda in the next 2 years when it comes to elder and disability justice. So thank you all for your service on this committee and for sharing your wisdom and expertise.
Great. Thank you, Susan. Have a great rest of the day, and we will certainly fill you in on the rest of this important discussion. So with that, I'd like to turn it now to Scarlet Hughes, who was volunteered or whatever that was, mandated to volunteer for the presentation on conservatorship. So Scarlet, thank you for being here, and we look forward to your presentation followed by discussion.
Thank you very much. I need somebody to let me share my screen. Oh, you've got my stuff. Okay, cool. However, I can't see my notes with you doing that. So if I could share my screen, I could see my notes.
Hi, Scarlett. I went ahead and made you a co-host, so you should be able to screen share, but let me know if you hit any snags.
It says that this will stop others sharing. Okay.
That's okay. Yeah.
Yeah. So let me just make sure you can see just my presentation. Yep. What do you see? Just my presentation?
Just your presentation. Yeah.
Thanks. Hi, everybody. I'm Scarlet Hughes. I am the executive director for the California State Association of Public Administrators, Public Guardians, and Public Conservators. Been doing this work about 36 years and have a huge passion for it. Our association is we represent all of the public administrators, the public guardians, and the public conservators in the counties, and they are county officials appointed by the boards of supervisors in each county. And our association is the certifying body, which means that we're legally responsible for training all of the public administrator, guardians, and conservators and all of their staff. They have to get their training and their certification from us. Our association is comprised of 3 programs, and it is the Probate Conservatorship Program, the LPS Conservatorship Program, and public administrators. Public guardians, for the most part, do the public probate conservatorship program. Public conservators tend to do mostly the public, the LPS program, and the public administrators deal with the dead in the county. So when someone dies and there's no one to deal with their final estate matters, and or sometimes there's exploitation, the public administrator will be pulled in by the courts to manage that person's assets and distribute their assets after their death. The organization of where public guardian, public conservators, and public administrators are located in the county varies county to county. So sometimes they're all 3 together. Sometimes the public guardian and conservator are separate from the public administrator. The public administrator could be under the sheriff, coroner, treasurer, tax collector, the DA. In some cases, there is the public administrator and the public guardian are together, but the public conservator is somewhere else. So that configuration is a bit of a challenge. It's difficult for people to know where to go. That's kind of the challenge with that. Carol, I saw you had a hand up. I don't know if they want me to wait until the end of my presentation or not to take questions.
Yeah, let's, thank you for that, Scarlett. What we'll do is feel free people to wait to raise your hands, but why don't you get through your slides and then we'll start the discussion.
Okay, that sounds great. So in most counties, the public guardian, the public conservator is the official that is responsible for doing conservatorship investigations in that county. And this includes investigations regarding forensic cases for incompetent to stand trial. These are cases where someone committed a crime and the court's trying to decide whether or not they're competent to stand trial. A lot of those referrals come to the public guardian conservator's office because they aren't competent. And so we get those referrals as well. There's only one named public guardian conservator in each county, public administrator as well. Although I'm going to focus mostly on public guardian and conservators today because that's what your council is mostly concerned about, is with elders and disabled individuals. So the Board of Supervisors appoints one county official, and then he has deputy or she has deputy public guardian conservators who carry out their duties for them. And the conservatorship is a court proceeding, which means that we legally appoint someone to be responsible for someone who's not capable of making decisions for themselves. There are 2 types of conservatorship, as I said, letter McPetrick short, which is LPS, stands for LPS Act, and that type of conservatorship is for an individual who has a severe mental illness and cannot make decisions for themselves. Probate conservatorship is for individuals who have some type of neurocognitive disability. Generally, this is going to be someone who has some form of dementia, oftentimes Alzheimer's disease. This is going to also be individuals who are intellectually disabled and or head trauma type individuals. There are 2 systems of conservatorship as well, which more further complicates the situation. There is the county public guardian conservators system, and then there is also private conservators. Many family members are appointed the private conservator for their loved one. And then there is also a private for-profit conservatorship system. Now, the public guardian conservators don't tend to get the money cases. Estates with large assets don't normally come to the public guardian conservator. Think of Britney Spears. That type of conservatorship is generally with a family member or with a court-appointed private conservator who does that for a business. When we get cases with money, it's because they're really, really complicated and they're really, there's a lot of conflict. The courts will take it away from a family, a couple of, 2 siblings are fighting over mom's estate, and the court will take it away from them because of the conflicts that are involved. and give it to the public guardian conservator's office. That's about the only time that we tend to get those big money cases. However, that doesn't mean that we don't get a lot of complicated estates. We do. As a public guardian conservator, I managed a winery. We had cows, we had pigs, we had an airport for a short time that I had to manage a bar for a short time. So you name the asset, we might have to manage that asset for that client until we can either sell it or get somebody else to take over, maybe as under a trust. Some basic facts about conservatorship are that all conservatorships, private or public, are appointed by the local superior court. The court may grant the conservatorship for the person and or the estate. It just depends on what the needs are of the client. The counties have cobbled together resources primarily from county general funds to provide $258 million in services for conservatorship in the counties. However, that's very insufficient for the need that is out there. Public guardian and conservators are the only county operated social service program that we're aware of that doesn't receive any federal or state funding at all. I'm going to give you a very brief overview of LPS, and then we're going to get into probate, which is more relevant to this council's purview. As I stated, LPS conservatorship is for Letterman Peck Short Act. It was a group of laws passed in the late 60s, which mandated that it provided due process for individuals who were being conserved, which meant that you now had your day in court, so to speak. You were appointed an attorney who represented you. Prior to the LPS Act, one doctor could sign one form and you could be put in a locked psychiatric facility for indefinitely, and you had no recourse. You had no ability to dispute the fact that you were mentally ill. So LPS was a really important set of laws that gave us all protections. With LPS, you have to be appointed the conservator of the person because that's the point of the conservatorship, is to force mental health treatment on that individual against their will. That's why there's various hearings that are held at the beginning of the conservatorship process. And that's a lot of the reason too, why people can cycle kind of through the system. Because once you get medicated and you clear, we can't hold you any longer. We have to legally let you go if you are able to give us a good plan for your care. So it is a system of protection, but it also is a system that can be problematic for the individual who then goes back out and stops taking their medication, and then they get ill again, and then once again their needs are not being met. The conservatorship, LPS conservatorship process does start with a Welfare and Institutions Code 5150. And that whole process is that you get detained for 3 days, you get evaluated. If you don't clear or you don't agree to treatment, they can hold you for 14 days more. At the end of that 14 days, the public guardian conservator's office must receive a referral to continue to hold you and treat you. Referrals come from acute care facilities, oftentimes now the jails, and it's based on grave disability, meaning that because of a mental illness and or alcoholism, you cannot make decisions for yourself. However, the issue with alcoholism is really not, we don't conserve people under that any longer, because the law required, when these laws got instituted in the 60s, there were a lot of institutions that treated alcoholism inpatient. So the law says if you conserve under alcoholism, they have to be put into a detox or alcohol treatment facility. Those don't exist anymore for the most part. So we don't conserve under that. I don't know anybody who does that right now. And the conservatorship terminates after 1 year unless you file your reappointment petition. Probate conservatorship is for individuals who have major neurocognitive disorders, mostly dementia type cases, a lot of Alzheimer's cases, and also head trauma, and some Intellectually disabled individuals, although most public guardians don't conserve individuals who are treated by the regional or to the regional centers. It is the legal basis of the conservatorship is that you lack capacity to make decisions. We can get full medical consent authority over an individual under a probate. We can't do that on an LPS. And we also can't prescribed psychotropic medications unless they're specifically being prescribed to treat dementia. That's a very important distinction. We don't have that power, and we can't put someone in a locked facility on a probate like we can with an LPS. Anyone can petition to be a probate conservator, but all LPS conservatorships have to come initially through the public guardian's office, although we do appoint a lot of family members off of our petition on LPS. We don't do that on probate. It's difficult to terminate a probate conservatorship because for the most part, there's no renewal process. Once you're on a probate until you can demonstrate to the court that the person no longer needs the conservatorship, or that individual dies, or that individual we find another individual to be the conservator who is as capable and as responsible as the public guardian conservator. So that generally, once you're on a probate, with few exceptions, you're on that conservatorship for life. Most of our probate clients are elderly, they're frail, many medical problems, lots of cognitive challenges, and also they can't manage their assets, they can't make daily decisions for themselves, and so we wind up doing that for them. The Omnibus Act of 2006 dramatically affected the public guardian conservators in the state. The Omnibus Act it made sweeping changes, and it required that the public guardian conservators begin an investigation within 2 days. It requires the court appoint the public guardian conservator if it appears that a conservatorship is needed. And it also required that public guardians file, even if the court doesn't appoint you, if you become aware that someone is in immediate threat or danger financially or physically, that you have to file. Prior to the Omnibus Act, public guardian conservators had more discretion about the types of cases that they took. And after the act, we lost a lot of that discretion. And so our caseloads increased dramatically after that. Current challenges and priorities. Currently, our biggest challenge is that we're critically underfunded. There's no dedicated state funding, as I said. There is a lot of new cases coming to public guardians and conservators from the criminal justice system because of the diversion from the prison system of individuals with any type of mental health issue out of the criminal justice system to conservatorship. We have seen a dramatic increase in that type of case, over 500% increase since 2016, created a lot of challenges placement-wise. There is also a significant shortage statewide of all types of placements, locked placements, board and care, skilled nursing facilities that will take challenging clients, even intermediary care level placements. It's a crisis all over the state. Public guardian conservators have no more priority than any other individual or system. We get in line like everybody else for our clients. I had a case where the court released an individual from jail, an elderly man who had committed a crime, but he also had dementia and some mental health issues. I had nowhere to put him. I told the court that. Judge didn't care. He had him discharged and brought physically to my office and said, he's now your problem. And so finding placements for our clients is a major challenge for all of the public guardian conservators. Our members are also seeing an increase in difficult cases across the board. So these are cases that have traumatic brain injuries, dementia cases, violent tendencies in some of those cases. A lot of the younger conservatees with mental illness are coming in with criminal backgrounds and violent histories. Those are really difficult for the public guardians to place. And as I said earlier, we have critical staffing shortages. We saw a dramatic surge in cases since 2017, 20%. And this has a lot to do with, as I said, the criminal justice cases, but also the aging population. We're seeing an increase in elders coming in. Our average caseloads are between 65 and 80, about 3 to 5 times higher than, say, Children's Protective Services is a similar system to ours in that they take responsibility for that child's life. We take responsibility for the elder's life or the disabled adult's life. And yet our caseloads are 3 to 5 times higher than theirs. And we don't get any funding like they do. And the other issue that we have, which I think was mentioned earlier today, is a lack of data. There's just no data out there about conservatorship. We do some internal surveys, but that really, which gave us some of the numbers that I gave you today, but none of the systems statewide to do any kind of tracking of the private conservators. I can't tell you how many public guardian conservator cases exactly. I did an informal survey, and we have about 8,000 probate conservatorships with the public guardian conservators and about 15 LPS conservatorship cases. But again, that was an informal survey that I did of our members. The lack of funding for public guardian conservators negatively impacts other systems as well. Acute care hospitals, psychiatric hospitals, county jails, the courts, adult protective services, the ombudsman, all of those systems are impacted because public guardian conservators are often considered a bottleneck in the system. All of these entities rely on the public guardian conservators to do their investigation and quickly move people through the system. However, because of the extreme shortages of staff and funding, we aren't able to meet the demand. Investigations backlog up in all of these systems and result in people staying in acute care hospitals, the jails, psychiatric hospitals longer than they need to be, just because we don't have anywhere to put them. And because we don't have the workers to go out and look for those placements. We can't, we have to prioritize the referrals that we get. So if I get a referral in the same day, I'm a deputy public guardian, I do LPS and I do probate. The LPS has a timeline that I have to meet by law. And so if I get a referral for an elder in, say, a skilled nursing facility or even in their own home, I may have to see the LPS person first, because the probate referral, I don't have that same timeline legally. I will get out and see that person as fast as I can, but I'm going to need to deal with the LPS first. If I have a probate that's at risk, I'm going to go out and see that person first, which means that the person sitting in the hospital who is safe for the moment is going to wait. And that's just a huge bottleneck in the system. Public guardian conservators are not aligned with any state department. So I get calls all the time from family members or community members who say, who do I make a complaint to? I don't like what this public guardian did, or I don't like, my deputy isn't doing something that they should be doing. Where do I complain? And there is no oversight except for the courts and the county structure. So if I'm the public guardian conservator, somebody makes a complaint against me, that goes up the county chain of command. It's going to go to my director or the board of supervisors or the county exec. There's no oversight from the state. There's no oversight of any regulations from the state. So what that transfers into is that there's not consistency county to county, because the funding is county general fund. Each county decides how much they're going to give the public guardian conservators to run their program. So you're going to get services that are very different from county to county. You're also, we provide, the uniformity just isn't there because of that. The Department of Social Services, the Department of Health Care Services would both be appropriate departments for there to be a conservatorship program underneath one of those departments to help us with uniformity, regulations, data collection, standardization. technical support, and also to allow allocation of funds through the department. I know that the Department of Aging has a new position that they have created. It's a conservatorship liaison. It's not clear yet because it's just been developed what that will mean going forward, but we're hopeful that in the future there will be some state partnership with public guardian conservators. So our association has submitted numerous budget requests over the last few years, trying to fund the public guardian conservators. The funds would dramatically help us increase our capacity to do referrals quicker, to prevent homelessness of people who are coming into the system, provide emergency response that we can't do right now, reduce the recidivism rate. All of those things would be greatly enhanced by funding for public guardian conservators. Our budget request this year was for $200 million, and that was to augment, not supplant, the money that the counties put in, which is $258 million. However, our budget proposal was not successful. We're part of a large safety net of services, and yet we're the only system that doesn't receive any funding. And a lot of people are baffled by this. And part of the reason is that the governor's office and the legislature isn't interested in funding anything new that they don't currently have to fund. So it's going to take a village of associations and systems to convince them that this part of the system is critical and that it's underfunded and needs attention. So for the moment anyway, we are going to continue our advocacy, and your council could be a major partner in that. By supporting our funding requests, by supporting a state home, by helping to develop data collection processes, and mostly to oppose anything new that puts any new requirements on public guardian conservators without funding. So that's my presentation. I can answer any questions you might have, and I'm going to stop sharing my screen.
Great. Well, thank you so much. What an very in-depth presentation and overview. Some of the common themes I heard in terms of a lot of issues that also relate to some of what else we've discussed in the other priority areas: siloization, lack of access to services, lack of data, the need for standardization across the state, just among others. And then, of course, you focused on the important resource issues and challenges that the public administrators, public guardians have been facing. We are very short on time right now. And I think it's clear there's a lot of space to move here. I'm going to ask, Ellen has her hand raised, and then Howard does as well. And then I want to see if anybody else has any general comments. But for sake of time, we might need to move forward after that. So Ellen, I will start with you.
Okay, thank you so much. Having worked in the PAPG-PC area for quite a few years, I'm well aware of many of the challenges, and I always see APS as the front door and public conservator and public guardian as the back door. And without that flow of individuals, especially with APS increasing the age being decreased to 60, I see the workload going to increase significantly. So I think one of the challenges too is the complexity of working these type of situations. There's a strong involvement with legal and a lot of probate code, W&I code you have to be aware of. It's not a quick job where you come in and just learn it in 5 minutes. So I just the commission was very much in support of your funding proposal, and we will continue to be so and look for ways to partner to make your recommendations a reality.
Thank you, Ellen.
Thank you, Ellen. That's very helpful. Howard.
Okay, thank you. And I will be brief. I know we're short on time. And I just want to say that I would like to mention, in addition to everything that has already been mentioned, that there is an alternative in at least some cases to conservatorship, and that is called supportive decision making, in which, you know, people will help a person reach a decision, make better choices. And I feel this will help reduce some of the load on the conservatorship system, and it will also reduce the possibility of, you know, people being declared incompetent and, you know, and railroaded into conservatorship because somebody wants their money or doesn't like them and just basically wants to get rid of them. And I feel that the supported decision making would be a really good option in some. I know that's not an option for every case, but in some of the cases, I think it could help. And I also want to mention there was a bill called FB 1663, I think, which is intended to make supported decision making more authority and have it done more often. And I think this is an option that needs to be considered, supported decision making. And by the way, just for the record, I am not under conservatorship and I have never been conserved. And I'm just saying that for the record, just so you know, but I hate to see people get their right taken away from them. No, if there's an alternative, let's take it.
Absolutely, Howard. Very important point that really conservatorship is the very last step if all other avenues have been exhausted. And I'm curious to hear, we are going to add 5 minutes into this discussion. We think we have enough time for that before we start talking about next steps. So I would love to hear people's thoughts on this concept of supported decision-making, as well as any other comments in relation to Scarlett's excellent overview and presentation. Vivian.
Yeah, so I really appreciate Scarlett's comments. I wanted to also just couch the discussion of conservatorship, just acknowledging that the probate conservatorship and limited conservatorship are different, and a lot of times we talk about them with the same word, but they are completely different legal tools and really are focused on very different populations. So I think it's important to highlight that because a lot of times I think we should just be very specific about when we're talking about probate conservatorship and, you know, people with cognitive issues that are probably never going to improve. Therefore, having that conservatorship for a longer time makes sense versus a limited conservatorship where someone may improve or may transition into supported decision making. I think it's great that Howard brought up supported decision making. I think it is a great option, but as he highlighted, it doesn't work for everyone. And I always really want to highlight when people mention it, just thinking about the fact that someone who is engaging in supported decision making and it works for them really is a person with a lot of supports. They've got people around them, probably money, stable housing, stable supports, and that is not going to work for a lot of people, especially anyone who is vulnerable to homelessness, experiencing homelessness. Actually, supported decision making might put them at risk for increased abuse because there may be people who are trying to prey on them through that system. So really looking at the system and knowing that nothing is one size fits all, and how we have to really think about who the vulnerabilities of each individual person and trying to figure out a system that actually really will work for them and actually protect them.
Excellent points. Thank you. It's helpful for me to hear that nuance, not being somebody who's so familiar with each of the systems, to understand the different tools that are out there and the importance of really looking at the individual cases for each consumer in determining the path forward. So great. I'm seeing lots of hands. Lisa, and then Claire, and then Anne.
I mute myself. Okay. Actually, Vivian took one of my points, so that was good. And really, in the interests of protecting people's autonomy, we're always looking for less restrictive alternatives. And clearly, supported decision making is something that we definitely need to be looking at. I was wondering, and Scarlett, that was a really terrific presentation. This is such a hard, complicated issue to explain. I was wondering if, in talking about less restrictive alternatives, I think there's a lot of confusion about limited conservatorships. And I'm wondering if you could just explain that, especially since there's legislation around that.
I'm not an expert on that particular type of conservatorship. What I do know about, most of the public guardian conservators don't do limited conservatorship. In my 30 years as a public guardian conservator, I don't remember having one. I might have had one early in my career, but for the most part, we don't do them. They're generally for individuals who have a developmental disability, and it's specific to a given issue. So for example, if that person, and maybe James is a better person to describe it than I am, but it's usually around a given issue that the client has. I can't honestly think of any samples. That's why I'm wondering if James has any experience with that.
I think you're doing a great job. Exactly. Usually I would say my familiarity is we represented in probate conservatorship. So I haven't actually represented in limited, but it's coming typically clients who are utilizing the regional center and then are coming of age as the typical case, I'd say. And then the powers are broken up into 7 arenas. I can't think of them off the top of my head, but then each power has to be justified to the judge, the court. So you can now ask for 4 of 7, you can ask for 2 of 7, you can ask for 7 of 7. Yeah. So that's my understanding.
It's very narrow. It's like a probate conservatorship is really broad. We have the powers to do most anything that the person would do for themselves. You know, sell their property if we have estate powers, make medical decisions, end of life decisions, decide where they live, decide how much money they get. We have full powers for all the person's life. Whereas with limited conservatorship, it's just that. It's very limited to a given area that client is having difficulty in their lives with.
Right. Thank you. Super helpful explanation with all of that. And again, I can see the importance of consistent training across the state, both for, you know, the delivery system to understand the options, but also for consumers to understand their rights. So Claire from our colleague at DSS.
Thanks, Sarah. Thank you, Scarlett, for the presentation. Just 2 things that are really occurring to me. And Claire Ramsey with CDSS, as Sarah mentioned. One is really thinking about how we've started to, I think, talk more thoughtfully about the continuum of like housing solutions for older adults and people with disabilities, and really talking about how the continuum works and builds and how people don't necessarily only have to go in one direction along the continuum, sort of from independent living into, you know, maybe eventually skilled nursing, and that the continuum can be more flexible than that. And so just listening to what you're all saying, it really feels like there's also a place to really have this conversation about the continuum of, you know, legal capacity, because it's not, you know, fixed, for us to sort of understand that people can move around within that distinction of whether they have full legal capacity and or if they've gone all the way to losing all capacity. And then, you know, when people can come back and move along the system. So just, I think there's just, and it's overlaying, right? Because obviously people in skilled nursing can have full decision-making capacity, people living independently maybe have lost some capacity. So I just think it's another piece of the framework for us to be thinking through. And then I'll just say that, thank you. These have been 3 great presentations today. And it just makes me think that maybe at a future meeting, us having a presentation on supported decision-making would make a lot of sense. And I do wonder about having someone from the developmental disability community come in and have a conversation about limited conservatorship, so we have a better understanding of that framework as well, because that's one I'm not as familiar with either.
Thank you, Claire. Excellent suggestions. And as I was saying in chat, I don't think we're at a shortage of issues to work on in this committee. So I think we'll be continuing to focus on where the areas are that we can place our attention. I believe, was there one more question? I thought there was somebody else that had their hands raised, but maybe.
This is Anne.
Oh, yes, Anne.
Yeah, I just had my hand raised. I'm an attorney at the Judicial Council, and I wanted to just follow up on that. I did put the 7 areas for limited conservatorship into the chat. If people are interested, we do have a lot of materials for that process. So if that's something people are interested in, happy to talk about more. And I did want to follow up on Scarlett's excellent presentation with that part of this. This is a good time to be having that conversation as things are changing. So for example, and talking about probate, and this is both limited and general, you know, AB 1194 was mentioned in one of the earlier presentations that changed the burden. So now no longer a person has the burden to show they don't need it. Anyone who objects to a petition for termination has the burden to show that the person still needs a conservatorship. And so that's something that I think people are not used to, as well as different duties for attorneys. And that's an area where I think there's a lot of training possibilities.
Great, thank you, Anne. It's wonderful to have you here. We are so pleased. We would love, you know, I think you're interested in being kind of a liaison to Judicial Council. We welcome that. We'll bring you into these discussions. I think that there's a lot that, you know, you can be helpful with in terms of navigating these issues and the discussion. So we look forward to following up. At this point, we really are, we're going to move forward. I think there's going to be a lot of questions about how we transition from these really critical priority areas, each of which could probably be the basis of the work for this committee for the year ahead on their own. But we have to figure out how we want to kind of structure the work and align it with that really important gap analysis work that Achilles and Andrea are leading. But in the meantime, the near-term priority is the exciting opportunity with our California for All Ages and Abilities Day of Action on September 20th that Amanda will be speaking to now. And then we will have a little discussion on how to take the work that has been presented today and utilize it as the platform for the meeting on the 20th. And we will, you know, continue that conversation, but I'm really pleased that Amanda is here to provide this update.
Good afternoon, everyone. I'm the project director for California's Master Plan for Aging. I've spoken, you know, at each meeting thus far, and last meeting I was joined by Andy Imparato, who is executive director of Disability Rights California, but also a member of the Implementing the Master Plan for Aging in California Together committee, the Impact Committee. We've talked about this before, and I hope that I have been able to put this day of action on everyone's calendar. If you haven't been invited to it on the calendar, please, it's just an oversight on our end. So please let me know if you need me to send that to you. I also have probably emailed everyone here at least twice about registering for the event anyway, which will also put it on your calendar. Please, if you haven't registered yet, go ahead and get registered. It is filling up fast. Within just 2 days, I think we hit over about 200 registrants. So, you know, we do have a max capacity. We cannot accommodate more than 500. It would be amazing if we got 500. So I wanted to talk a little bit about what we need to do to prepare for this day of action. And as we discussed last time, we're really looking for every single one of the aging and disability related committees in California, and there are 8 of them, who will each present their platform comprised of 2 to 3 priority recommendations to the administration for inclusion in the master plan in 2023 and 2024. So our expectation, our hope is that everyone can attend in person. It's at the Sacramento Convention Center. The event starts at 8:30 for stakeholder committee members. So there's going to be plenty of time. The actual program starts at 10, but between 8:30 and 10, you have an opportunity to register, as well as join your fellow committee members for a bit of a meet and greet and essentially your fall meeting and preparation for the platform you will be presenting later in the agenda. We also ask that as we go through this process, that the committees submit their agenda items by the end of August, so a little over a month from now. We've already, discussed so many priorities. There's a lot to work on, but as Sarah said, short term, what are those top things that you want to see in the master plan for aging specifically for implementation over the next 2.5 years? I am also lucky that I have Eric Dowdy here, who has been voluntold to help herd this process. What I've suggested to other councils is a work group for every recommendation, or one lead work group to sort of steer the recommendations across the different priority areas. So this time we have set aside probably only have maybe a little bit under 10 minutes is for you to share your thoughts on how best to organize all the work you've talked about today and what parts you're going to tease out for September 20th.
Great. Thank you, Amanda. That's super helpful. And I'll just say too, I mean, each committee will have 7 minutes. So I can see that people are probably thinking, how do we get everything out in 7 minutes, right? But as Amanda said, it's thinking about what are the near-term priorities, and you can couch it in the context of a longer-term priority of system change, right? So I think that we already have 3 priority areas that you all have been looking at, and there might be ways to organize within that. And you could have cross-cutting themes across each, like data, system connectedness, partnerships, or I don't know, however you want to organize it. But before we ask for feedback on how to organize, we also have to have some time for public comment. But Eric, I'd love to turn to you and see if you have thoughts, given that you've been voluntold to help with this process before the end of August. Any thoughts that you have as to next steps?
Yeah, I would really love volunteers to develop those work groups. I think we could probably accomplish this in a couple meetings between now and the end of August and get recommendations through maybe something like a Google survey. So if there's a willingness to do that, I think we could, work in that direction. I just need to get, I think, a core group to start. Maybe we can expand from there, but that's what I would love to see happen. I think that might help the most at this point.
Okay, great. Thank you for that. If the thoughts that other committee members have on that point. Okay, I mean, and the goal of this is to not make it more difficult. It's to basically highlight, the top issues that you think need to be addressed in the next round or iteration of the MPA. And then we take that internally and consider what we might be able to do with that and build it into the master plan. It doesn't mean that what you put on those priorities are going to limit you to the work that you're doing over the next 2 years. Like, you can still explore a range of issues and policy recommendations through this committee, but it's more what right now do you want to put on the radar for the master plan. If people are interested in kind of being part of the lead group that helps flesh this out, I'm going to guess, Eric, that we might even be able to hammer it out within 1 hour long meeting, because I feel like we have a lot that you all have already presented just through this meeting, and it could be just a way to kind of summarize it. I'm happy to help out with that, Eric, however you'd like. But if you are interested in being part of that process, please put your name into chat now. That would be really great, because we want everybody to have their voice heard through this process. Okay. Let's see here. Any other thoughts from committee members, or Amanda, any other thoughts from there? Otherwise, we will follow up with next steps. And we hope to see you all on the 20th for sure. Thank you all. I see a few folks raising their hands. We will note who that is following up, and we will set up a time with Eric's assistance in terms of when it works for him and how to proceed from here. Okay, so at this time, we now have public comment before we make our closing remarks. Any members of the public? Maria, I'll turn it to you to help us out on this end.
Thanks, Sarah. It does look like we have, excuse me, a couple of people with their hands raised. Just as a reminder, if you're joining us by phone, that key is *9, and that will add you to the queue and we'll unmute you. And if you're joining us by webinar, there is a raise hand icon on your toolbar. Also welcome to engage via the Q&A. I think most of the comments that have been submitted have been made public, or committee members have responded to them. So feel free to check that out at your leisure. And for now, we'll turn to Judy. Judy, go ahead.
Thank you so much. This is Judy Mark. I am the president of Disability Voices United, which is a statewide organization directed by people with disabilities and their family members. I'm also the parent of a 25-year-old son with autism who has significant support needs and practices supported decision-making and is not conserved. You know, I wanted to express my concerns about some of the information that has been provided around the conservatorship issue. First and foremost, I love the name of the council, that it is a Disability Justice Council, but I feel like when you're talking about conservatorship, you're not doing it within the context of disability justice. Because if you were, you would be talking about the fact that people with disabilities are having all of their rights taken away through the conservatorship process. And we should be thinking about empowering people with disabilities and people who are suffering from aging disabilities and trying to reduce those numbers substantially by offering alternatives and by educating family members and others about these alternatives. I also wanted to clarify the questions people were asking about limited conservatorship. So limited conservatorship is for people with intellectual and developmental disabilities. However, the vast majority of people in limited conservatorships have all of their rights taken away. All 7 powers are taken away from them. So in theory, you're looking at, oh, it's just for one little thing. It's just for the finances, or it's just for the healthcare, but that's not the way it plays out. In fact, it plays out where all the boxes are checked. And in fact, there was a time when they were even taking away people's rights to vote. And they still do that, by the way, in occasions. So, you know, I don't want to have it look like, oh, but limited conservatorship is okay for people with developmental disabilities because it's only a little thing and these people can't really make decisions anyway. Please don't make it sound like that community is okay in this process. It is also a civil rights problem for them, and as well as with others who are in the full conservatorship. So, you know, I'm really hoping that in the future, as you're considering the issue of conservatorship, you're looking at it from a disability justice lens, that you listen to people like Howard and others with disabilities, because they should be at the center of all of this. Thank you so much.
Thank you so much, Judy. That's really important considerations. And, you know, I think that something I did hear was that conservatorship is absolutely the last resort, but it is very important to hear that perspective. And we appreciate your speaking up on that issue. Any other public comment?
Yeah, looks like we have a hand raised. Maureen Sullivan. You may need to unmute, but your line is open.
I did not have my hand up. That was an error. I'm sorry.
Oh, that's okay. Okay, I'm not seeing any additional hands raised. Couple of highlights from the chat. Lisa shared some resources that's in the Q&A if you guys want to check that out. Lots of conversation around limited conservatorship there. Lots of consensus around some of the comments that have already been made. And Sarah, I will turn it back to you to see if there's something else you want to do with the next 10 minutes. I'm not seeing any hands.
Okay, well, that's super helpful. Then I think, you know, we had a lot of hands raised and comments. I just want to turn it back to our members on this council to see if there are any other comments or considerations, whether in relation to the issues raised today or whether in relation to next steps for the day of action. And Scarlett, I see your hand raised.
I just wanted to respond to a question in the Q&A. Someone asked, what about, Heidi asked, what about the expense incurred by the elder to fight an unwanted conservatorship? If someone files a petition for conservatorship and the elder or anybody doesn't want the conservatorship, the court will appoint an attorney for that client. If the client doesn't have any funds, then the client doesn't have to pay for it. The court will cover that. So just be aware that you can ask the court to appoint an attorney for that individual at no cost.
Thank you for that so much. Vivian.
I also wanted to highlight, now that we've kind of discussed the, differences between limited and probate conservatorship. I think this really, emphasizes one of the 5 equity guiding principles that we put into our document, and it's number 4, which is that we acknowledge that while older adults and adults living with disabilities have many overlapping interests, they're distinct communities, and any policies examined by this council should examine the impacts to each community. So I think that just bringing that up, that we have put that in our equity guiding principles, and that's something that we are going to be considering with any kinds of suggestions or of reforms that we have, because we know that these 2 communities share a lot of similarities, but there are a lot of differences. And I think that will hopefully really guide any kind of recommendations that we have around conservatorship, knowing that there's a variety of different people who are impacted by conservatorship.
Excellent point. I love that we're going to be using the equity framework that you and the team developed, Vivian, real time as we look at these different policies. I think that's a really important point. And Marty also said that he thinks Judy is raising a good point in that often processes such as limited conservatorships may not be working in the way intended or the way is authorized by state or federal law. That goes back to the issue, no matter what solutions we put forward, that a foundational next step is that any solution must be linked to a whole person-centered outcome and not outcomes that only measure utilization, et cetera. So excellent points, very thoughtful consideration of all of these different issues. Gloria, you have been patient with your hand up. We'd love to hear from you.
Hi. Yes, what I was wondering what I would like to say is that it seems like they're talking about the limited conservatorship as if it's something that a person is like, I'll just use a small example, like in jail, sort of, their life is in there and they can't move around. But most of the people that I come in contact with kids with disabilities or young adults, some of them are forced to have a conservatorship because they've told me time and time again, when their son that's 18 years or over, they go to the hospital, they go to the doctor, they won't even let them be in the room with them. They won't tell them anything about their medical appointments or what's going on, or if the doctor calls and they want to speak to the person. They said the first thing they say is, do you have conservatorship or do you have guardianship? And some of them can't afford it, or some of them don't even know exactly what it is. So like myself, I do have conservatorship of my son, limited, because he was born in 1.5 pounds and intellectually delayed, of course. But I had no idea that supportive decision making even existed. So if that's what it seems to, the way I see it is the people that are talking about it, they should share that with others, because I've never heard that before. All I've ever heard of is conservatorships, general and limited, but I've never heard of supportive decision making. I've heard of guardianship. So that would be a good idea if you could have some kind of information for others. Mm-hmm. And I've heard a lot of bad things about conservatorships and good things about it. But for my decision, I think I did the right thing for my son. But like I was saying, a lot of family members seem to feel like they don't know what to do, because now they're confused with supportive decision making and conservatorships.
Right. Excellent points, Gloria. And I think I'm seeing a lot of themes about, need for training and outreach and education on all of these issues, and a lot of misinformation that's not intended to be misinformation, but just a lack of clarity on the system and the parameters around it. So excellent points for that. Okay, I'm just seeing if there's no more open-ended questions. Really, I have absolutely loved this conversation for the last 3 hours. I found that it went by very fast. So on behalf of the Department of Aging, I just want to say thank you so much to our presenters, starting with Lisa and Vivian and Achilles and Andrea, and then moving into all of the presenters on the priority areas, including Lisa Coleman and Valerie Smith and James Treghieri, and then of course concluding with the presentation from Scarlet on the public guardian and conservatorship system. So just it was a lot of work for all of you to help prepare for this, so we really appreciate it. What I appreciated is that you all were the ones informing us in our understanding. We heard from you. We utilized the expertise of this council to help advance our thinking in these spaces. Clearly, we have a lot of work to do, but I think it was an excellent way to structure the conversation. And of course, we always welcome your feedback on how we can use your time most effectively and meet the objectives of this group. So with that, I'd love to turn it over to our chair, Eric Dowdy.
Thanks, Sarah. And I'll just echo the thank you to the great expertise in the virtual room here. I mean, I've learned so much just over the last 3 hours. I never knew so much about this area. So again, thank you. And we will be in touch around the next meeting in August. And I guess that would come from Amanda or myself, but there's 10 names on the list. So I want to thank those of you who stepped up to that. And we will look forward to seeing you very shortly to continue the conversation. So thank you.
Yes, thank you. And yes, I'd like to just also give a shout out to our wonderful ASL interpreters who have to interpret often very fast speakers. So thank you for that. You guys are amazing. And thank you all for your time. We look forward to talking with you soon and seeing you on the 20th of September.